Hi everyone. I'm here today to talk a little bit about cardiovascular disease. It is the #1 cause of death globally, so we ought to take it fairly seriously. Now I know most of you go to the doctor and you have your cholesterol checked. So let's back it up a little bit and learn a little bit about what we need to understand about when people have heart attacks and strokes, and then why is it important to check the cholesterol. So what happens when you have a plaque? It's like a deposit along the arteries. And unfortunately, it's a very metabolically active place along the artery, and it can get inflamed. And almost like a boil, it can get swollen, rupture, deliver a lot of inflammatory goo, I call it, highly technical term, into the bloodstream, and then the blood forms a clot around it. So when you learn that somebody has had a stroke last week, a heart attack last week, your friend is in the ICU with a heart attack. What's happened is that plaque along the coronary artery has ruptured, and then a blockage has formed very quickly, and downstream, no oxygen, a heart attack. All right, so now that we know what we're trying to avoid, when you go to your doctor and have a cholesterol test, and most classically we have a cholesterol, LDL, which is considered the bad kind, HDL, which is considered the good kind, and triglycerides measure. But I would suggest that there are some more sophisticated tests now. We're doing them at our office here at Wellness First, and they are a little bit more specific that kind of help predict a little bit better if you are potentially making a plaque and how inflamed that plaque might be. Those are really the two questions. So, LDL, for the most part, can measure what's going on in terms of trouble, but it's really not the whole story. There's a form of cholesterol called apolipoprotein B, or ApoB. And that's the form of LDL that's had a protein wrapped around it, and that's the form that can be driven into the artery wall and start to form a plaque. So it's your level of apolipoprotein B that we really want to understand about. Now there is a tricky way that you can do a workaround and find a close approximation to your apolipoprotein B, and it's called your non-HDL level. So if your doctor does a cholesterol, LDL, HDL, and triglycerides, you can take the total cholesterol, subtract the HDL, and get a number. That's called your non-HDL. And it pretty much approximates what your apolipoprotein B is. That number should be less than 80, 70, 80 to be optimal. So if you have had just the traditional cholesterol panel, take it out, look at your total cholesterol, subtract the amount of HDL you have, and that number will be your non-HDL and be very close to what your apolipoprotein B is. That's number one. So that's kind of trying to understand how much do you have of this part of your cholesterol that could go in and start to form a plaque along the artery wall. Second, you want to know, well, how much inflammation is there? How likely is that plaque to be forming like a boil, more swelling, more inflammation, putting a lot of inflammatory goo, back to that again, inside that plaque. There is a test called an LPPLA2, and that is a very good marker of how much inflammation is being produced from your plaques, all the plaques throughout your arteries. So that's a really useful test. The poor man's test, the test that we used to do was called a C-reactive protein. You're likely to have had one, but that C-reactive protein will pick up inflammation anywhere in your body, not just along the plaques. So if you had a tooth abscess, you had a bad knee, your C-reactive protein could be up, and it really is hard to determine about plaque inflammation. But this LPPLA2 is a good marker of plaque inflammation. So I hope that's a little primer on your basic cholesterol panel. And you may now be able to ask your doctor a little more specifically for values that will mean something more to you. Now, before I go, There's one more thing, and that's your triglycerides. We didn't talk about that, and they're always measured too. Your triglycerides should be low because that is a measure of how much prediabetes, metabolic syndrome is going on in your body. Now, the lab value that the lab will say is okay is anything under 150. But quite honestly, if it's not well below 100, like in the 70s or 80s, you are metabolically pre-diabetic. You need to be getting that triglyceride low. And how do you do it? Cutting out the sugar, cutting out the alcohol. So before we leave, I think you ought to also think about your triglycerides. Pull your old record out, take a look and see what those numbers are. Your non-HDL and your triglyceride level, and maybe your C-reactive protein. But the next time you go to the doctor, ask for these more sophisticated tests. I think they'll help. I hope this has helped. Stay well, and remember to always choose your wellness first. Thank you.